Every life matters. Every race, every gender, every experience and belief has value in the world. Society has conditioned us to believe that we're vastly different from each other. But scientific research has proven that the genetic makeup of human beings is over 96% similar. So why do nearly 60% of minority groups of patients report more incidents of inadequate health care? For the past 3 semesters, the Office of the Vice President for Health Sciences has given me a very special opportunity to create a series of diversity programs for high school, pre-health, and professional health students at Virginia Commonwealth University. Participants learned how to embrace our differences and build a bridge to promote diversity, inclusion, and equitable health care, from the examination room to workspaces across the healthcare industry. When DHSD and the Office of the Vice President for Health Sciences initially asked me to develop these diversity healthcare programs 2 years ago, I think at that time we thought that it was quite simply important to teach you all how to set your biases aside to ensure that all of your future patients had equitable access to health care. But in a very short period of time, I began to realize that some of you as students didn't value your own differences. Some of you didn't understand that your differences have value, not only in the world, but in establishing more meaningful relationships with your patients. And when you establish more meaningful, deeper relationships with your patients, what happens? You become more effective healthcare practitioners.
This program has affected me a lot. I'd like to think of myself as somebody who appreciates diversity from the get-go, even before coming to this program. But what it has shown me is just how little I know.
So a bias is more of a set of beliefs or ideas about someone. That could be either positive or negative. A microaggression would be an active form of a bias. And a microaggression could be, I'm not going to give you the job because just by the way you look, I don't think you can handle it. You are the doctor. You are the patient. You are her mother. You have just been diagnosed with stomach cancer.
Hi, so your results are in. We, as a doctor, I'm going to say that you should get chemo, which should start it immediately.
No. We'd like to take a holistic approach instead of chemotherapy. Is that like an option?
If it becomes aggressive, which hopefully it won't, we can look into chemo as a more serious option.
Although I'm a political science major, I plan to go to graduate school to get my social work degree. So her information about incorporated arts and social work and science and everything together to just have creative solutions to have people healed holistically, I think that's really important and something that I'll take with me.
If you look at artists like Leonardo da Vinci, who was not only a visual artist, but was a scientist, an inventor, he knew that there was a profound connection between the arts and science and engineering and physics to create innovative solutions. And I am telling you, I'm not going. There's no way I can ever go. Darling, there's no way.
I think the coolest thing was when she went all over the places like Nigeria and stuff. She would use music and dance to promote education and teach them stuff like about AIDS prevention and just all that mathematics, interpersonal skills.
Unfortunately, there are millions of people around the world that suffer because they don't have equitable access to the human rights that we were all born with. Access to education, food resources, health care. Why do you all think diversity is important? Freedom. All right, give me something else.
Love.
Love. I love that. Ooh, they're impressed. Okay.
So my perception of diversity first was like to have this multicultural and multiracial community, but now I know that diversity is not limited to this, but also is a diversity of thoughts.
I was one of the lucky 50% that actually survive a heart attack. I know. I don't look like heart disease. The next 4 months, would be a series of misdiagnoses, of blunders that unfortunately all can be related back to my perceived difference.
People will forget what you said. They will forget what you did. They will never forget how you made them feel.
Under the age of 18, they go to a children's hospital, and that children's hospital will assign a particular advocate for her. Who's the pimp? I mean, is there other girls? Are you afraid of your life? Some people sign incredibly well, but you have to remember, in the healthcare provider, if they're in a healthcare providing situation, if they're extremely sick or if they're kind of out of it, their skills may not be there.
All your skills, all your passions, anything that you're good at, it can all be combined into like producing the end goal. And for me, the end goal is to make change and have a positive impact through healthcare.
So on the first day of human care class, you were given a rather unique assignment. That was to identify the causes and symptoms of the isms that unfortunately prevent people from receiving equitable health care.
Ageism is basically unfair treatment or discrimination against somebody based on their age.
So everyone thought 31 to 45 years old. And actually, the artist who made this is 98 years old.
Wow.
And he made it on Microsoft Paint.
I see on your form that you did not identify as male or female here, and I was wondering why exactly that is.
I'm a transgender, and I didn't have any options on my form.
Oh, okay, I see. Well, I'm sorry that I have to waste your time, but unfortunately I just don't feel comfortable treating patients like you.
Being mindful that the purpose of any healthcare provider includes patient-centered care, and also enhancing the quality of life for all of your patients, not just simply those that share a similar lifestyle as you.
Ageism is something that not only affects older Americans, but it also goes to both sides of the spectrum, affects younger people too.
What brings you in today?
I haven't been feeling like myself lately. I've been feeling really dizzy and tired. Lately, I haven't even been able to go to my dance class.
Dance class? At your age?
But because they were young, the doctor didn't take them seriously and just kind of brushed off their opinion instead of actually using it to get to the root of the problem. But in reality, the younger person was right, and their grandparent did have orthostatic hypotension.
That's not ableism. That's just a modification. Yeah, that's just a modification. Not ableism? This is not ableism. What about this one?
If you need the definition, there it is up on the board.
To make sure that they still have
5, 4, 3.
Breast cancer is a real thing, right? And males actually get it too. It's commonly like a misconception that males don't really get it, you know? But like, we do get it, and it can be through like genetic factors, or like if you're exposed to more estrogen than normal, you can develop breast cancer.
For us, like our age group, it affects youth age 24. Every 1 in 5 youth HIV diagnoses is going to be someone from 13 to 24 years old.
I think that this type of class needs to be incorporated into every higher level education, maybe even undergraduate for every single student.
Diversity rocks! One day all men will be free. No more. The meek shall inherit the earth. He shall bring righteousness and prosperity. Let your burdens fall. He'll supply all you need. The children of the world all kneel down. Let the truth